Afternoon, everyone. I'm going to be posting some stuff in the chat box for links that I'll want you guys to be able to access throughout the presentation. So just if you can open up the chat box so you can see it, and then we'll go ahead and I will share my screen with you all as well. All right, let's see, share screen, here we go. Move you guys over here so I don't have you in your vision area. So today I'm going to present a little bit on the impact of COVID-19 on children's mental health. But I was hoping to also make this a lot about what you all need and what you're looking for out of training. So I'm going to post a little survey in the chat box. And if you can go ahead and go to the link and answer what you're hoping to sort of get out of training today. The link should work. It should bring you to a website called Menti. And you can go ahead. It's completely anonymous. I will see your responses, but no one else will know who's made the response. So just go ahead and take a few minutes to indicate what you're hoping to get out of today's training. So it looks like we have some staff already coming in. So I'm going to move it over to the screen so that you all can see some of the responses. So how to support children, early interventions for kids and their parents, how to present information to parents. Look at all this wonderful stuff that's popping in. Yes, how to support families and young children during the pandemic, more knowledge. I love it. Great stuff. And so hopefully, as you guys are still typing some stuff in, I imagine our board's going to get really full, and I'll try and pop in throughout through the presentation to make sure we're trying to cover some of the stuff that you all want to cover. But this is a good way for us to hear kind of everyone's voices without clouding a chat box and without with everyone getting a turn to sort of tell us what they want. So awesome. Thank you guys for posting it in. So here are the learning objectives that I created for today's training. The first is to understand the impact that COVID-19 has had on young children, specifically birth to 5. Increase your knowledge about how the pandemic has impacted perinatal and postnatal period for caregivers. And then also to be able to identify early indicators or need for intervention and linkage to mental health providers. So I like to call this the parking lot. I'm going to post one more link in the chat box, which is going to be a place where you can kind of, if you have questions along the way and you want to ask them and you don't feel like kind of like raising your hand or anything like that, you guys can put your Q&A questions and I will come back to this at the end of the presentation. So I'm going to go ahead and post that link in there as well. For those of you who love QR codes, feel free. This QR code right here will take you right to the Q&A section, and you guys can post any questions as they come up. Probably won't see them very well through the chat box. So if you have something that you need to stop me along the way, I'm cool with interruptions. Go ahead and just interrupt me, and hopefully I'll be able to answer your question. All right. All right, so I feel like we can't talk about COVID-19 and the pandemic without addressing the ACEs study. And I'm sure many of you are familiar with the ACEs study, but for those of you who might not be, the ACEs study stands for Adverse Childhood Events. This is something that Kaiser did a long time ago. And what they found was that the more adverse child experiences, they'll increase the likelihood for adults to later on have maybe some health challenges, poor academic achievement. And this is more about like a relationship that exists. It doesn't mean that every child who's had an adverse childhood event is going to have, poor academic achievement are going to be more likely to get diabetes or a heart condition. But what they found is kind of a trend. So there's been some talk about even including the COVID-19 pandemic as one of these adverse childhood events. They haven't completely added it yet, but there's some talk around it. So I think over the next couple of years, we might see some of the ACEs study be connected now to the COVID-19 pandemic. So what we know about children and is that when a system, so a mom, a dad, a caregiver, an aunt, an uncle, grandparent, when the system is stressed, children, they breed on it, they feel the stress. And so it can create some sort of toxic stress, even when the baby is in the womb. Babies experience toxic stress when their parent who's carrying them is either experiencing some sort of domestic violence, financial stress, substance use related issue, familial stress. So it can affect even little babies in the womb. And so it's really important that we support caregivers during this time to help them mitigate, so to reduce the impact of COVID-19. I wish I could say that we are out of the pandemic, but we're still very much in the thick of it, and we're seeing lots of fallout. We have children who started school during the middle of the pandemic, children who experienced things like food shortages, financial insecurities. We have the formula shortage right now. So there's lots of things that are happening that are impacting our little ones. And so I think one of the best ways to reduce the risk of the ACEs is to provide early intervention. So I'm really excited that you all are here today and you're going to be able to be part of reducing that risk. I think someone mentioned how in the first part, what are they hoping to get out of today's presentation is how to talk to families about mental health. And I think a lot of it, we can't do any of this work without breaking the stigma. So I'm going to play a short little movie clip for you. Somehow I feel like I might not have hit to share sound. So if someone, when the video starts, if they can't hear it, if they can just let me know, and then I'll reshare the screen so that you can all hear the video.
You know that feeling where your thoughts scare you or make life tough? Sometimes it feels like no one else in the world has those thoughts or feelings. No one seems to know how difficult it is to deal with your feelings. And it's not easy to share your deepest secrets. You might think something is wrong with you, or you might worry what other people think. And all of that makes your thoughts and feelings.
Apparently we are having a connection issue. Hopefully it will.
Worse. Our culture has created this environment of shame until the 1960s.
Seems like we're having an internet connection issue. Hopefully you all can still hear me. And so for whatever reason, it seems that the video does not want to play right now. But I think one of the most important things that we have to think about when we're working with families is how to talk about mental health. Sometimes mental health has that negative connotation, like, oh, am I crazy? Or how can my baby have a mental health challenge? They're so young, or they don't really understand. And I think that what's really important to take away from this is it's often just how we talk about it. I think when I'm working with my clinicians and they're going into a home and they're going to talk to a family about mental health services, I often say to them, maybe don't call it mental health services, right? Maybe we talk about it early intervention, or talk about, increasing the relationship between the caregiver and the kiddo. And some people have negative experiences. Maybe they've been labeled with some sort of mental health condition and they're like, I don't want my child labeled with that. So the question that came up is this video in Spanish? And actually, I do not believe this video is in Spanish, but I think you can get the closed captioning, and I think you can select Spanish. but I'm not entirely positive, but sometimes that works on the YouTube clip. So it's right down here where we can check the subtitles. And maybe what I'll do is after the presentation, I will send the links of all the videos over to the consortium. So if anyone wants to access the videos and share with families or watch it on their own, you'll have an opportunity to look at those videos. So I think we can't talk about mental health stigma without figuring out what our own thoughts of mental health are. So I'm going to throw another Menti question in here. And as I'm pulling it up, I'm going to ask you guys to start considering what your own thoughts are regarding mental health. So I am going to copy the link and I'm going to put it in your chat box for you all. Flip back over here so we can see some of your answers as they start coming in. So far we have some anxiety, trauma, the need for support. I love how Menti sort of organizes things all over. Peace, mental health is health. Oh, I love that one. Love it. Well-being, yes. Some people definitely think when they hear mental health, they hear a diagnosis. I think that's where parents get really worried is when they start talking about their little ones and getting or accessing services. They're like, someone's going to label my kid, or that maybe there's something wrong with them, or that they're going to need medication, and that there's something wrong with their child, that it's a problem. When I get new clinicians and I'm talking about, 0 to 5 work, and they say, well, how do you do therapy with little ones? And I'm like, we play. We teach families how to play with their little ones. We play with the little ones. I think it's almost going back into our own childhood and sitting down on the floor with kids and just sort of meeting them where they're at. I think I've worked with all ages across my career, and my absolute favorite age to work with are these little ones. I just feel like they have no filter. They say what's ever on their mind. And sometimes they're saying it with words. Sometimes they're saying with their behavior or actions. So it's really fun to watch little ones. And feel free to keep adding stuff to this as we go through the presentation. The link will still be live. You should be able to continue to vote and add things in throughout the presentation. So feel free to always go back to the links if you want to at another time. Okay, so man, I feel like there's so many barriers right now to accessing services across, whether it's occupational therapy services, mental health services, speech therapy, regional center support. I think some of that has really been impacted by the pandemic. Do not have enough providers to be providing all the services that are needed. So one of the biggest barriers, at least right now, is just not having enough people to provide the service. But as a parent myself, I wouldn't let that be kind of the stopper to asking for services, because there are laws and regulations out there. And we'll talk a little bit about that today, about getting kids services despite not being enough providers. So right here is kind of a list of things that I've noticed that can really prevent or cause a block to getting services. Sometimes it's parental mental health challenges. Maybe the parent is experiencing postpartum depression or anxiety. Just as a reminder, both moms and dads can experience postpartum. I don't think we do enough screening on dads for postpartum challenges. And I think it's really important that when we're working with families, we're not just asking the mom or the identified mom about what's going on for them, but we're including the dad. And so if dad's at work, connecting with dad during a time that they're not at work, or really just including all the caregivers in the treatments. We don't want to leave anyone out. Sometimes it's a history of neglect or abuse. Sometimes there's a barrier where it's single parenthood, or maybe a parent has to work in order to put food on the table. And so they have a hard time getting to sessions, or they don't know where to create the time for it. Probably the one that I think is least talked about is like temperament mismatch. So that's basically like maybe a parent who's like really, really reserved. And then we have like a baby or an infant or a toddler who's like super active. And so like their temperaments don't match. So that the infant is wanting lots of engagement from the parent, but maybe the parent's more reserved, or the parent is extremely outgoing and the child is like more like slow to warm up. And so I think we can't look at like the relationship between caregiver and kid without looking at how each of their personalities are, because that's really important. Poverty and financial stress can definitely impact a barrier. Relationship conflict or challenges, substance use, and can't do this presentation without talking about the impact of COVID-19. In the beginning of the pandemic, there was like a really, really quick shut to services, or what it felt like a shut to services. Lots of providers switched to like a Zoom platform or virtual platform. Believe it or not, as a 0 to 5 provider, we found ways to get Zoom into the homes of our little ones. Initially, it might have been a little bit of a challenge, but we've actually, since over the last like 2 to 3 years, have really come up with some creative ways to get little ones. I remember in the beginning of the pandemic, my therapist, they would come to me and they'd say, sessions are so stressful. The parents running around the house with their iPhone, chasing the little kid from room to room. And I remember saying to them, why? Why are we having parents do this? Why are we having a parent chase their kid with their phone, and we're adding to the stress? What about just meeting the kid where they're at? So the kid's running in and out of session. What would you do if you were there in person? Would you necessarily be telling the parent to chase the kid through the house? Probably not. You would just sort of be there. And when the kid popped their head into the Zoom session, then they popped their head in, but you would be working with what the family was bringing to you. So we're back to providing in-person services and have been for a while, but some of our families are still opting to do Zoom sessions. And so really want to find creative ways to get these little ones involved. And we have been successful. This is a little chart here, 5 ways to end mental health stigma. And I think part of it is like the psychoeducation. 1 in 5 children experience a mental health condition and do not receive the treatment they need. That is absolutely crazy to think about, because that's quite a lot. And I think some of it is because they don't know how to access services. They don't know that the services are available for their kids. They're not sure if they want to get their kid assessed because they're afraid of a label. And so I think as like for you guys who are going in the homes and providing that initial support, I think if we can have you guys talk about mental health services in a way that makes the families feel like, oh, this is something we can do, or I am interested in sort of seeking out help for my kiddo. We don't do any mental health services for little ones without the parent or caregiver. So it could be parents are working full time, but the kid's at a babysitter. Great. Let's work with the kid and the babysitter, and then collaterally work with the parents when they have time off from work or when they're home. I wouldn't want us to not provide services just because parents were not available at home. We would want to engage the entire system for these kiddos. Anyone take a pause for any quick questions or comments? Oh, okay. We had one about temperament mismatch, but then we have the never mind. But, I think it's worth actually going back to even mentioning that, like, I think it's kind of similar to like, if you can experience, like, have you ever been in an office building before where like somebody's hot and somebody's cold and everyone wants to mess with the thermostat, and someone's saying, oh, turn the air conditioning on, and someone's saying, oh no, turn the air conditioning off, right? That's kind of an example of mismatch. We all have like a different like temperature reading, and sometimes we're like more cold or more warm. And so like finding like, there's never like one perfect zone for everyone. We never can find like an exact temperature that works for everyone, but like maybe we'll see like some people who have those little space heaters on, right, to accommodate, for it. And then Gianna, you wrote, what about, I think you're talking about highly sensitive, like, kids with sensory issues. I think some of that also comes into play. Like when infants are born, one of the last things to fully develop is their vision. I don't know if anyone's ever watched, or maybe you have an infant. Parents, they like will get like right in their face and they're like, oh, no, 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 no. Right. Sometimes that's really overwhelming to a little kid. Their vision is short. And so that's why the parent thinks that they need to get really close to them. But a kid who's like overstimulated, maybe by like a noise, that could like really they could do what I call like a disengage. They might try to like move around, they might start like crying, or they might do like a head gaze the other direction. And I think part of the work that we need to do is helping parents recognize kind of like these nonverbal like cues. So like I think like one of the easiest nonverbal cues is like, and most of us have probably experienced like feeding a child before, like we're giving them like a spoon and like, the kid's like, oh, one more bite, whoop, the airplane in, and then a kid starts like pounding on their tray or they're turning away. Like that's a really good sign that the kid needs a break. It doesn't mean that they don't necessarily like the food. This just means like you're overstimulating them. And I can share some resources later on that talk a little bit about like learning and recognizing those infant and baby cues, because those are super important when kids don't have like the verbal skills yet. And every kid is different. You may have given carrots to this child 100 times and they loved it. And then one time, all of a sudden, you're like bringing the carrot, pureed carrot to them, and they're just not having it. They're like bubbling at the lips. They're all like moving in the chair. And sometimes it's just like, hey, they don't want carrots today, right? It's just, or they just need a break, or put the spoon down and let them feed themselves. I mean, it gets messy with little ones, but sometimes they're just like us, right? We can say, hey, we need a break, but kids sometimes can't really like say it because they don't have the skills, but they show it with their body. So there's some really good videos out there on like infant and like toddler nonverbal cues that parents can watch, which is really helpful. So let's talk about the perinatal period with COVID-19. Just out of curiosity, like I know we have a large room, but I think it'd be cool to survey. So if you can put in the chat box, if you know someone or yourself who has been pregnant during the COVID-19 pandemic, I'm just curious to survey the room, or even unmute yourself if you were one of those people and just say, me. Yes, we have some people that were pregnant, gave birth during the pandemic.
I was.
Awesome. Yeah. And depending on when this happened during the pandemic, I think there were an array of challenges. I know my brother, they had their first baby in the beginning of the pandemic, and they're about to welcome their second baby. And I said to them, man, you had a baby during the COVID-19 pandemic right at the beginning, and now you're having a baby during a formula shortage. Talk about stress. I mean, what? I mean, they're the two kids that they're one who's about to be born, and one that they had during the very beginning of the pandemic, where they really were limiting visitors in the hospital, right? Like many families where there were fears in the beginning, like, is my partner even going to be able to be in the room? And then it was like, okay, maybe your partner, but what if you had a doula, or what if you had a mom or a friend who you wanted in the room? Could you have them there? I mean, I'll share a very short story because I think it's super relevant. But my brother, like I said, they had a baby in the beginning of the pandemic, and during the delivery, my sister-in-law was hemorrhaging, and that was very scary. My brother had always like imagined that like the first few hours of his baby's life, because he was like, I don't know how to be a dad. I don't know. He thought like that she would just do it all, but unfortunately, due to the hemorrhaging, she was rushed off to surgery, and he was left with a brand new baby, and he didn't know what to do. And I remember chatting with him on the phone, and he's like, the baby's crying and I don't know what to do. I said, the baby's hungry. And he was like, yeah, but she wants to breastfeed. I said, well, she's not there to breastfeed right now. So, and she's in the middle of surgery. So you need to feed your baby. He's like, but I need to be there for my wife. I said, well, right now you can't be there for your wife. She's in surgery. You need to feed your baby. And my mom was only like a block away from the hospital. And she was like calling the hospital, let me come in and help my son. And they're like, you can't come. And he's freaking out. And then I was like, feed the baby. And he was like, well, what do you mean feed the baby? I said, ask for formula, do something. Your baby is hungry. I mean, you don't know how long she'll be gone. But he was in such like a heightened state of crisis. Like he wanted to be there for his wife. He also had this idea that his wife would be the first one to change the diaper and to feed the baby. And all of these things were not going as planned. And I think that talking about these birth stories for families is so important because that is a huge part of their recovery. Traumatic birth experiences, that is something worth processing with families, even such as like something like their birth plan didn't go as planned. I think especially during the COVID-19 pandemic, there are so many people's birth plans that didn't go as planned, or interventions or things that looked differently. I mean, in the beginning of the pandemic, we had like, should women breastfeed if they have COVID-19? Should we take their baby away from them if they're testing positive for COVID-19? We've had since studies show that like the antibodies in the breast milk, and we have all this stuff. But at the beginning, we had none of this. No one knew anything. And so many individuals were just getting different information. I don't think we can talk about the pandemic without talking about racial inequalities. I think outside of even the pandemic, pregnant women who are Black and Hispanic have a higher rate of mortality and illnesses than related to the birthing experience. And some of it is just it's not about biology, right? It's about what's offered to these women. And some of the greatest projects I've seen is like the doula support program for through maternal, I think it's Black infant mental health, right? So all these families that were eligible for a free doula, right? A birthing person to help them couldn't even come into the hospital because they weren't allowing them. So could they Zoom into the hospital? Were all of these individuals and mothers getting the same amount of equitable services as other mothers? And so all of this stuff was happening on top of being and birthing during the pandemic. And I think as educators and as individuals who are working with these families, I think we just need to ask, tell me about your delivery. Tell me about your birthing experience. What was it like? What was your pregnancy like? Did you get your partner or your support person to be able to attend doctor's appointments with you? Beginning, many women who were birthing didn't have partner support at even those perinatal visits, right? They weren't allowed to have anyone there. And sometimes like the first time the person that they identified with their support was at delivery. Sometimes, depending on when they birthed, sometimes it was, they couldn't come because, they weren't allowed in the doctor's office. I remember like a lot of our clients in the beginning, they had virtual perinatal visits, right? So there was a reduction of how many perinatal visits families were getting because they were limiting face-to-face services. So it was done over Zoom, right? Lots of things have happened. But I think the one thing that we can do to help is just start asking questions. Tell us about what your birthing experience was like. I cannot believe this is like the one thing I believe so strongly. I said it takes a village to raise a child. I mean, where was the village during COVID-19? So many villages were destroyed, right? Like we didn't want to involve, older like caregivers, like grandparents, because we were worried about COVID-19. Lactation support groups sort of shifted during that time. Baby and me classes or mommy and me or caregiver and me classes shifted. And so a lot of the support that was naturally out there before was sort of like gone until we've sort of all got our footing. I think we're starting to get closer to some sense of like support, but I still think that even today we have a reduction in support that's available to moms. Some of it is they just don't know about the resources. So If you haven't had a time to look at, Maternal Mental Health Now, website, I think that's an incredibly valuable resource. We have the Black Daddies Project going through maternal mental health. We have COVID-19 support groups for women who have birthed during this time. And I think it's really important to get the services to these parents and not be a barrier, meaning like, because we don't know about it, we don't offer it. And so the more we can invest in knowing what's out there, the more we can help families. Take a little quick peek at some of the comments in the chat box. Yep, high alerts at hospital, increased like stress during the birthing procedures. We definitely want to be listening to our families. And one of the really cool, it looks like maternal mental health, we have a link posted in there. Thank you so much. One of the things that is coming back is like this concept of infant massage. And so for those of you who are not familiar with infant massage, it's not that the practitioner is massaging the baby. It's actually a practitioner teaching the caregiver how to massage the baby. So babies have an array of issues. It could be colic, it could be just general like muscle tension. It could be caregivers having a hard time connecting with their baby, could be some postpartum issues. And so infant massage is such an incredible resource, and it really helps build the relationship between child and caregiver. And the caregiver could be a grandparent, it could be a foster parent, it could be biological parent, an adoptive parent. And it's a really, really great way to help with babies who maybe have a mismatch. I know someone talked a little bit earlier about temperament, and they asked about it. Temperament, this is such a great strategy when they have a misaligned temperament between caregiver and baby, is just helping them do infant massage. Babies who are born by C-section, right? There is some, muscle tension sometimes if they had been stuck in the birth canal and hadn't really gotten, all the way through. And so then maybe there was C-section. So there's a lot of benefits to infant massage. And so I really encourage you all to be reaching out to find local, and I think they've done some Zoom infant massage as well. So definitely kind of a good strategy to use with some of these caregivers who have birthed during the pandemic. Infant massage, just as a side note, is usually from 0 to 6 months. So we're looking for like a pre-crawler. And that's just what the guidelines are for infant massage. I think you can still do like relationship building with kids that are older than 6 months. It's just not in the context of infant massage. Any questions or comments on kind of how the perinatal period had been shaped by the pandemic? So I think if you took anything away from this, I would want you all to take away is ask parents about their birth. Ask them, tell me your birth story. Talk to me about it. That can be incredibly cathartic for families who maybe didn't have the birth that they wanted. And so just talking about it can be incredible. So I encourage you to ask your families about it. The bottom picture is actually my sister-in-law who had her baby during the pandemic. I loved how the sunlight was hitting her cute little baby bump. And the top picture, I don't know if anyone's ever seen anything like this concept of like breastfeeding, the tree of life, where we have all these roots sort of shaping in like the mammillary glands and going into the baby. But so I just think it's a cool photo. And they have little apps online that parents can take their own pictures and turn it into these tree of life stuff. And that's pretty cool to watch your own baby in that. So I wanted to also kind of look at kind of an idea of like the different areas of pregnancy that were impacted during COVID-19. So we have the biological, systemic, psychosocial, and as you can see, the bio, the psychosocial, they all kind of intertwine at some point. But if we wanted to look at them individually, we can start with like the biological stuff. During pregnancy, there's so many things, hormone changes that are happening. Your blood volume increases during pregnancy. sleep disturbances, mood changes. Sometimes there's a suppressed immune system, which definitely made people more like worried during COVID-19. Like initially, like, should pregnant women get vaccinated? Should they not get vaccinated? Are they at more risk for COVID-19? So that definitely was impacted during the pandemic. Social issues during pregnancy. We had a lot of families being isolated. They didn't have their friends or they didn't have their family around. We saw like an increase of what, like drive-through baby showers, right? Where like everyone would just drive on by. No one would like normally like have like the baby shower, everyone shows up and they're bringing all this stuff. They're like these quick little like drive through, honk your horn and go. We've seen drive through birthday parties. I mean, we've seen it all. And we still see some of this, right? So we're still like, depending on where everyone sits on their thoughts of COVID-19, some families are doing more get-togethers and baby showers, and some families are still not doing them because their fear of the, COVID-19. So we have an array. And then we have people's opinions about it, right? So maybe you sit on one end as a pregnant person and your family sits on another end and they're wanting one thing for you, but you're wanting one thing for yourself. So we see some familial stress happening because everyone's in different like places. I think there was, I don't know statistically if we have the statistics yet, but there was some increase possibly or some domestic violence stuff during the pandemic. We saw a lot more families isolated at home. And so maybe more people, there was an increase in stress. So there's some statistics out there that have saying that there's an increase. There's some that are sitting on the other side saying that there was no increase. I'm not sure if it matters whether there was or wasn't. I still think it's important to talk about. So, we have families who maybe were living in homes that felt not as safe. And so that definitely impacted the perinatal period and postnatal period too, of pregnancy. If we look at some of like the psychosocial stuff, I think many women who didn't get together or birthing people didn't get together. So they didn't know like, hey, is this normal? Like, what am I feeling? Is this like how I'm supposed to feel? I mean, thank goodness for social media. I think that served as an outlet for many families. They would get on blogs and they would be connecting with others. But for some of our families who maybe not had access to internet, right? They didn't have those resources. So definitely we see some inequalities between, different socioeconomic statuses, resources that were available to some families that were not available to others. We have some families who were able to work from home, but there were lots of jobs that couldn't be worked from home. So we have many families who were working during the pandemic, some who lost their jobs in the service industry. So all of these things really impacted the perinatal and postnatal period. And if I go back to the very, very beginning of what we talked about, toxic stress, this stuff that we're talking about did produce some levels of stress. And, our little babies that were in wombs did feel it. The good news is all of this is fixable, right? I mean, we can work with little ones, we can work with families. I think the biggest risk is if we don't talk about these things and act like none of this happened, then we risk the fact of missing kind of all of this. So it is important that we talk to families about how they've experienced their pregnancy. So I'm going to move on a little bit and talk about children. I am a 0 to 5 therapist, so some of this is geared towards younger kids, but I will talk a little bit about older kids because we have siblings in homes, right? I don't think we're only servicing young children. So I decided to start with this hierarchy of needs. Some of you may have seen this before. Some of you, this might be your first kind of time seeing it, but I think it is important because I would say that during the middle of the pandemic, a lot of our families were right here. How am I going to put food on my table? How am I going to keep my kids safe? How am I going to pay my rents? How am I going to pay our electric bill, our heating bill, our water bill? And it's almost like therapy during this time really shifted to like this need for focusing on safety, right? So we really needed to get into these homes and and help the families with basic needs, right? Did they have diapers? Did they have formula? And that's still unfortunately an issue right now. Did they have wipes? Did they have groceries? Did they have toilet paper, right? Like, how can we talk about challenges if those needs weren't met? And so I think it's important to recognize, like, maybe in the beginning when we're working with families, we want to make sure that they're feeling safe, that they have their needs met. And if they don't, we need to help them find ways to get those needs met. If a family tells you, I'm stressed, I've been to 20 stores looking for formula and I cannot find any, or I'm stressed because my partner is working and now it's impacting my milk supply. Those are things we really need to get in and do the work with first before we can do any of this other stuff. We've got to start there. I mean, eventually, right, we can help them move up this pyramid. But if we skip over all of this stuff really isn't going to happen. And so some of this is the training, right? So training therapists to recognize the importance of that early case management, but also is that collaboration with community partners. So families are looking for resources, finding where do those resources, where are they at? Is there diaper clinics? Is there formula clinics? Is there a place to get it? Can we link families back to their pediatrician? So we really want to not miss that stuff when we're talking with families, because all of that stress is going to impact these little ones. So I did find a little bit of research. So out of Chicago, I know we're in California, but Children's Hospital of Chicago decided to do a little survey in 2020, and they asked families about the pandemic, and 71% of parents said the pandemic had taken a toll on their children's mental health. I probably think that number might even be higher. I have a private practice, and I can't tell you, I think every single day I probably get at least 5 to 6 phone calls of families looking for mental health services. And I have to tell 5 to 6 families a day that I am full, which is an awful feeling. And then they're telling me you're the 20th or the 100th therapist that I have called looking for services. So I think some of the things that we can do for these families is take that off of them and help them get connected, look for resources for them, because I'm a mom of 3 young children under the age of 7, and they all have been at different points of during the pandemic. Some of them started schooling during the pandemic. Some of them were semi-born during a pandemic, right towards the end of it, or sorry, the beginning of it. And so they've left. In social skills development, there was no daycare spots. There was no wanting to take them to daycare, right? So they have limited social exposure. But of the 70% of parents that they talked to, 69% said the pandemic was the worst thing to happen to their child. That's big. 69% people said that this was the worst. Just out of curiosity, maybe by even just a raise of hands, you can throw it up on your reaction screen on Zoom. Is this surprising? So thumbs up if it's surprising, and thumbs down if it's not surprising. Like, these are the numbers you might have expected. I believe there should be a little reaction button somewhere around here. We have some comments in the chat box as well. And definitely talking about things taking a backseat just to survive. But yeah, we have some thumbs up. We have some thumbs down. It's kind of a mix. I think when I read that statistic, I was like, oh my goodness. I knew it, but just seeing that number and it took me back for a minute to think about the worst thing. That's a hard thing to sort of think about. When we entered the lockdown, kind of as we'll call it, where everything sort of initially shut down, many families were sent into isolation. There was a decrease in services. There was a limit, limit to resources. There still is limited resources at times, right? Every system's kind of been stretched, but all of these things have continued to add to the stress of families, and this is how it's impacting our little ones, even school-age children. The 69% is not just specific to 0 to 5; it's all children in general, so 0 to 18. And kids are kind of impacted at different levels. I don't think it's the same. I think there was this meme in the beginning, we're all in the same storm. And then someone's like, yeah, but we're in different boats. And I think that that is super important. Yes, we all are going through the same storm. I get it. We're all a part of the pandemic, but there's so many different boats in the storm, right? And so it's really important for me, but all of us, is to recognize that we might be in a different boat than the next person, right? What's impacting us might be not impacting someone else, or what's not impacting us might be impacting someone else. I think it's important to recognize that we are all in the storm, but we are all different size boats. So that's something to sort of take away. So let's look at some of the systemic breakdown that we saw during COVID-19. So what we know is that 1 in 7 children have been directly impacted by the lockdown globally. So this is not specific to the United States. This is globally. And then there's been, and I don't even know if this number is all that accurate. I imagine it's hard to grasp all of it, but 1.6 billion children have suffered some loss of education. And I think we can be on all sides of the argument. Zoom school was great for some and it was not great for others. And, you know, everyone sat in different areas of it. But what we do know is there was an increase in mood and anxiety disorders during COVID-19. And it went up to 75% of an increase. So that's a huge increase. Social problems, 64%, and neurodevelopmental disorders. I'm not entirely sure that that number is 100% accurate. And the reason I will say that is because the testing has really been a variety of ways. Some people have resumed in-person testing. I've seen IEPs recently where it said due to COVID-19, they did delayed eligibility. So they're making children eligible for special education services at school, but they're not really doing the full battery of testing because of COVID-19. So I don't know how accurate the neurodevelopmental is, but at least this is what UNICEF is saying. So we'll go with it. But I think that that number may be more or less depending on how we're really measuring it. I mean, I think I mentioned in the beginning that there's this like great resignation, right? Lots of not enough providers, not enough OTs, not enough doctors, not enough therapists, not enough teachers, right? I mean, all of our systems are being stressed. Long wait lists for service providers. I mean, months and months and months for accessing speech therapy or occupational therapy. We have a little bit of Zoom fatigue, both as providers ourselves and for our kiddos, right? Who maybe a lot of their stuff had moved to Zoom. In terms of like little ones, I mean, kids learn through play. And when there was this shutdown of like no social groups, no like take your kid to the daycare or take your kid to the park, or stay 6 feet away. I have a 6-year-old and my 7-year-old was sick the other day. She just had like a little cough and I was listening to them talk and he was like, I got to stay 6 feet apart from her. And I'm like, that's impossible. We live together. What are you talking about? And like, then she was upset because he was saying this and she felt bad. Like no one wanted to be around her. And he was like, he's the little kiddo who started during COVID schooling. So that's like what had been drilled into his head for all the, you know, the last year and a half, 2 years is 6 feet apart. And I'm like, she's your sister. You can't stay 6 feet apart from her. It's impossible. We all live together. But, you know, some of that stuff coming out. And I remember watching the two of them play in the beginning of the pandemic. And they were playing the virus game. And I swear every little bone in my body as a mom and then as a therapist were colliding. So I was watching them play this game and as a mom, I wanted to intervene and be like, because they were like having people die and they were like killing each other. And I'm like, what is going on here? And I was watching them and I wanted to like run in and like rescue them and like tell them that this isn't true, that you're going to be okay. And then the therapist part of me was like, no, I need to let them play this game, as disturbing as it is to watch. And I remember just like wanting to cover my eyes and like cover my ears and just pretend that it wasn't happening. And I mean, there was such a conflict between like being a provider and being a mom at the same time. And I mean, I, in the end, let them play their virus game out. And I think it was their way of sort of like working out their thoughts of the pandemic. But I think that I can't have been the only parent who experienced this at one point where we're like, oh, do we do something? Do we not do something? I mean, there's so many examples. And I think talking to families about what has real life been for them over the last 2 years is so important. Like, my kids go to school in Orange County, so I know it's a little bit different, but when they were told they didn't have to wear masks to school, I remember sitting down with my kids and I was like, some kids are going to continue to wear a mask and some kids are not going to wear a mask to school. And I don't want you saying anything to anyone about their mask other than, hey, your mask is cool. Right. So then I was worried about like, were my kids going to like, kids, whether they were wearing them or not wearing them. Like, all of these things are coming up, and things like, parents having different views about masks, vaccines. We have parents who are separated or divorced, co-parenting stuff. All of this stuff has been inflated with the pandemic. Do we do visitation exchanges during the pandemic and all of this stuff? So many stressors that it's important for us to really get in and start talking about the things that these families experience. But I think the other part is us providers, whatever kind of provider you are, you don't have to have the answers, and it's okay to not have them. I think like that's got to be a shift too. Like, just talk with your families. If you don't know the answer to what they're asking, it's okay to say, hey, I don't know it. Let me get back to you. Because you might be their point of contact for questions to be asked, and shouldn't have to know everything. I know I don't know everything. And there are times I've had to go back and look at things and come back up. So a lot of that. And then we saw some like Head Start and early Head Start systemic breakdown, like were they going to be in person? Were they going to be remote? And how many hours a day were they going to be? And then parents felt like, do I sit with my kid during these hours? Like, but I have to do X, Y, and Z, and I have 3 other kids in the home. So there was a huge thing with like those early programs that normally would have been available to families that had limited availability. I know a lot of the Head Starts in Los Angeles County, they have these like parent socialization groups, but all of those ended or stopped during the COVID-19 pandemic. So parents didn't even have like times to like connect with other parents. So lots of changes. Hopefully some of that stuff will continue to get better throughout time, but I still think we're still very much in the pandemic and some of that stuff is still being impacted. So I said it at the beginning that I'm a 0 to 5 therapist, but I'm still going to give you some information about, older kids, because I think for every one child that we're seeing that might be in 0 to 5, there's probably siblings in the home. And so one of my other like all-time favorite resources is the National Trauma Stress Network. And so this is a little chart that they have. This is not my chart. I can't take credit for this. Where they kind of looked at some of the challenges that little ones and older school age kids have and like what they are and kind of how to help cope and help parents. I don't think you need to be a therapist to do any of these things. So, for little kids, like they often experience stress in what I call like somatic. So like toileting issues, headaches, diarrhea, stomach aches, sleep disturbances. So when kids are feeling stressed, we see a lot of that stuff happening. So they're going to their pediatricians, or they're saying my kid's not eating, or they're always having complaining of headaches, and no one then says they're stressed, right? And so that's where I'm asking all of you to come in and say, hey, maybe there's some stress happening. Like, how can we help? Right? So kids who are toilet trained are regressing in toilet training, right? Or kids who are like having trouble like now going into like primary education because they've been home with their caregivers for the last 2-3 years consistently. So we want to look out for some of that stuff. It doesn't mean that just because your kid is having a headache means that they're stressed. Sometimes a headache's a headache, but sometimes a headache is something more. And I'll make sure that you guys have access to these charts, because I think that they're super helpful. So no need to, or if you want, you can screenshot it. I don't really care. But if you are trying to write it all down really quickly, don't rush. You guys can access it all later. School age kids. I mean, we have kids who like have been home and now they don't know how to interact with their peers, right? So kids are getting in trouble at school, or they're not sure how to like play. And then, or kids are, really like isolating at school. They just go to school and they like only are gonna just do the school and then come home. And so, or parents who want to have play groups don't know how to even get play groups going because no one has phone numbers for like other parents of kids in their class, right? So a lot of things we're still seeing the fallout of this. So the more we can like get in and be creative with families, I think that allows us to, get these families the help that they need. I'm really hoping that this video works. So I'm going to try playing it. Hopefully we don't have any connection issues, but if we do, I will make sure that you guys have access to these videos later. It looks like we are going to have an issue. I don't know why we're having it, but I will make sure that you all have these videos to watch because I was really intentional of the videos that I chose. But I will send Jana an email later today with all the links for the videos for you all to watch on your own, because I think there's some pretty cool stuff in the videos. And I think that these are cool videos to show families that we're working with, because it's a way of talking about stuff when maybe we don't always have the words for it. I think someone put in the beginning when I asked what you guys wanted to learn about this is like, how do we talk to families about early childhood mental health services? And so this is just kind of a little like, what are the goals? So when we think about infant and toddler mental health services, it's really systemic. It's really working with the entire family. I don't think a therapist goes into a family's home and says, well, let me sit down with your 2-year-old, right? It's more like, tell me and let me sit down with you as a family. And so all the work we're doing is really family oriented. One really cool thing to know is that even babies and toddlers can have like emotional like stuff. And so there's some research out there that says like depression, and I'm putting it in air quotes because we're not going to diagnose an infant with depression, but depression like symptoms, right? So being withdrawn or being sad or having difficulty regulating mood can be seen in even like the first 2 to 3 months of life. But remember, we're not diagnosing little ones with depression. We're just saying they might have some like depressive like symptoms. Little ones like attachment stuff, right? Having hard time like overly attaching to other people or maybe under attaching to their caregiver. I think if I were to like survey all the families I've worked with, I think like a majority of families at some point have gotten a call from like the preschool or the daycare saying that their child is acting out or acting up, right? And so like, how do we support those families who are getting these stressful phone calls from daycare providers or preschool or, even early ed? How do we help their kid like regulate their emotions, and how do we do that and support families? And a lot of it is kids learn through relationships. And so relationships are crucial for little ones. And so we really want to enhance those relationships with their caregivers. And some kids have multiple caregivers, right? It could be mom, it could be dad, it could be grandparents, it could be babysitters. We really want to educate even like teachers and early Head Start teachers on like how to help support little ones. So that's actually some of the work that we're doing right now, is really like changing the way teachers and, facilitators that are working with kids, how they view little ones' behaviors. For the most part, behavior is intentional. And so there's something there that they're looking for. It doesn't mean that they're intentionally acting out. It just means they're looking for a moment of connection. I think a couple of years ago, I had brought a quote and it was like, if we change the way we look at misbehavior and we look at it as looking for opportunities of connection, for me, that really changed me both as a provider, but also as a parent. Like if my child is acting out or having a misbehavior, if I can look at it as that's an opportunity for him and I to connect, then that's what the behavior is about. It's not that they don't want to eat their dinner, or that they don't want to stop hitting their sibling, or that they don't want to share a toy. It's just they're needing help. They're like tiny little bodies are needing help with connecting. And so if I can hit the pause button, that helps me think, okay, what is it that my child is looking for right now? What is it, something that they need? And I think that that's where we can slow down like the process. So I don't think you need to be a therapist to say this, right? And so I think as, any person that is working with young children is, hey, I'm curious, like, what do you think your kid's trying to tell you right now? Like, what is it you think that they might be looking for? And just having those conversations. There's a lot of what we're doing in treatment, but I mean, we can be doing that as teachers, as educators, as babysitters, as caregivers, as moms and dads and aunts and uncles. It's like, hey, what do you think this kiddo is asking for? Like, what is their needs? There is treatment for very young children. I think Jana mentioned in the beginning, I'm a child parent psychotherapy practitioner. That is a specific model for young children, 0 to 5, but can go up to 6, right? For children who've experienced some sort of trauma. We include perinatal and postnatal depression, anxiety as trauma. So if the caregiver has experienced some sort of mood challenges during pregnancy or continues post-pregnancy, that is considered trauma. And so it's a way of working with the family to support them and support the caregiver as they're going through their own stuff so that we can help the child, connect. But there are lots of different programs out there for little ones and older kids as well. But, some of the, big ones right now for 0 to 5 is child parent psychotherapy. And it's all about work with the client and their system of care. So we might involve multiple caregivers in that. Any questions on kind of like how to talk about early childhood mental health? I know there's some stuff in the chat box, so I'll try and take a peek at some of those questions as well. So in terms of locating mental health services, I think like with most things, it's about who you're connected with. I think, there are lots of community mental health providers in LA County. And while I wish there was like a one person that you could go to and say, hey, like I have this one kid that needs services. In general, mental health, access is really, you have to go to each agency and find out if they have openings. And so while there's not a hub for it, I would, 211 call and get a list of providers. You can go to LA County's DMH website, type in the address of the parent to see, someone put the DMH website to see what provider is closest to the family's home. In terms of school-age kids, there's a lot of schools that have connections or contracts with mental health programs. So checking in with the school or Head Start, early Head Start program. If, there's the regional center to reach out to, if there's some concerns of any developmental delays, but I definitely would encourage going to the DMH website and finding a program that's closest to the family's home as a starting point. But yeah, those are all really great questions about. And then I think someone had asked about perinatal and postnatal. So the maternal mental health website or Maternal Mental Health LA has a directory of maternal mental health providers who have sort of been vetted, meaning they have some additional training in maternal mental health. So they have a list of providers, their contact phone numbers of who to reach out to. And then for looking for child parent psychotherapists, same thing, true. They have their own website with a list of providers. But I would say if the family is wanting to use their Medi-Cal services, so they're a Medi-Cal beneficiary, you want to start with LA County DMH as the starting point for looking for providers. Any other questions regarding like accessing services? So let's talk. I mean, I've spent a little bit of time talking about when intervention might be indicated, kind of talking about like those stomach aches and headaches, but I wanted to kind of have a slide all on its own. I would say if I was looking at an infant, I think the infant I would be most concerned about is the infant who's always sleeping, right? The not crying infant, the infant who's just like, where a caregiver would say, oh, there's nothing wrong with my baby. They sleep all the time. They never bother me. Man, babies are supposed to cry. They're supposed to wake up to eat. And so I think the important part is here is not to like brush off like a baby who is just like really like doesn't cause the caregiver stress. So the baby who's like constantly sleeping, right? Like that might be a baby we want to think about, right? So that kind of goes into like failure to thrive conditions or lack of gaining weight, right? So working collaboratively with the child's pediatrician. Is there like an organic, like medical reason that the child's not gaining weight? Or is it something else that might be going on in the home that might contributing? Could be colic, could be reflux issues, could just be that the parents like really depressed. And so we want to kind of look at like not just the infant or the toddler, we want to look at the whole family when we're looking at stuff that might be needing to be intervened on. Kids are incredibly complex creatures. I swear, like one day they'll present one way and another day they'll present the other way. So we want to look for patterns, right? As there's been ongoing sleep issues, too much sleeping, too little sleeping, too much eating, too little eating, right? A baby who's maybe restless or has, difficulty calming themselves down. Are they not meeting developmental milestones, right? Things like this. We want to be on the lookout for the stuff like this. And I know I've said it and I'm going to say it again because it's literally the most important thing. Children learn in the context of relationships. Children need at least one healthy relationship at the very least. They could have lots of people in their lives, but they need to have at least one relationship where they feel incredibly secure, because that's where they're going to do a lot of their learning. And children learn a lot, believe it or not, when they're sleeping. A lot of like, I don't know if you guys are familiar with like sleep stuff, but like at 4 months is a good example of what we call the sleep regression. So we have a baby who slept really good for, and has in a routine, and all of a sudden their sleep is all over the place. It's because they're going through a developmental leap. So if you're ever wanting to find out when these developmental leaps are, the Wonder World, there's like the Wonder app, and it has like your parents can create an account and it will tell them when their kid's going to experience a next developmental leap. And so when to expect like changes in sleeping or eating behaviors. And so like the first major one we see is at that 4 month, because they're starting to learn to like roll over. And so that's why their sleep is so disruptive, is because they're practicing rolling over in their sleep. But it's hard. And it also unfortunately coincides with many people's maternity leaves ending. For parents who now have to go back to work, it's also around the same time. So it's interesting that all of that coincides here. So Wonder apps, that is what I would look up if you're looking for like a quick and easy digestible sort of information. If you're looking for something more advanced, I mean, there's, the touch points from Barry Brazelton, but I don't really know how accessible that is to most parents. So I tend to like say the Wonder Weeks app is probably the most accessible and user friendly. So I would encourage families to get something like that. And it's free, doesn't hurt. So let's look at some of the signs that we might see in babies and toddlers when there might be some mental health challenges. So the not wanting to be held, or eating or sleeping challenges, the losing skills they could once do. That's a really important one. Sometimes it's like organic, right? It could be something like Sanfilippi syndrome, which they call like early childhood Alzheimer's. That's like a new thing that I have just recently started like noticing. So like if a child was previously being able to walk and all of a sudden they can no longer walk, or they're all of a sudden not very coordinated, or their speech is regressing, we want to look and always rule out organic first, right? So the first point of contact should be back to the pediatrician. Want to rule that out, but there's nothing medical going on. And then it might be a linkage to mental health, right? It could be like, hey, there's some stress in the home and we want to get services for these families. But it's just important to sort of like look out for this stuff and notice patterns or changes and disruptions. So like I said earlier, the most worried person I would be is the baby who never is fussy. Babies are supposed to be fussy. So those are the babies that I worry about the most. Any questions on things to look at or comments? Just take a quick peek. All right. So here's more of kind of a breakdown between ages, because I think, it's good to recognize that infancy will define as 0 to 12 months. Toddler is like that, like 2 to like 3-ish range, and preschool age is like 3 to 4-ish range. So these are some things that are specific to ages to sort of look for. With everything, take it with a grain of salt. I think it's important to know that just because a baby does X doesn't mean that they need it. But what it does mean is it's probably good to like keep our eyes or ears open for a little bit more, right? Like a kid who, is like losing interest in things or people. Sometimes it's just developmentally normal, like what they used to like, they're less interested in, but sometimes it could be indicative that there's something going on. So I think I've never met a parent or a child who's been negatively impacted by trying to find out if they need mental health services. I feel like there shouldn't be a reason to never not refer. And maybe I'm a little biased, but I feel like any intervention is better than none. And so I think if you're on like the cusp of like whether you should or shouldn't, I would say you should. But again, I'm biased because I just don't think anything bad's going to come out of like a parent and a caregiver interacting and building their relationship. Like, I just don't see something negative. I think people think when they think mental health, they're like, oh, my kid's going to be diagnosed and have, medication put on them. Just as like a side note, for 0 to 5 children, there's a totally different diagnosing system that is used in Medi-Cal. They do not use the same diagnosing system. And so I think that that's kind of an important thing to know. We use something completely different that's specifically targeted to 0 to 5 children. And medication is not the first. Many medications aren't even available for children 0 to 5. I think there's very few, if anything, that one would even prescribe a 0 to 5-year-old. So I think if the family's fear is about medication or labeling, maybe kind of like providing some psychoeducation about like, it's just different for 0 to 5-year-olds. There's just a different system that we look at. And I just want like to open the space for questions. We're going to have about 15 minutes left, so I'll go back to that Q&A, but I just want all of you to know that we absolutely make a difference, that anything that we're doing, any contact we're having with families, that completely changes the trajectory, the pathway. If we can come in and we can provide any interventions, we've done something good for that family, even if it's just like connecting them to like knowing that the library has like materials that they can check out to enhance like their, books or little games or things like that, that they can play with their little baby. And, we can teach our families like how to play with their babies too. I think like when I'm working with some families and I ask the parent, like, what do they remember from their childhood? And sometimes they say, well, I don't know how to play with my kid. No one ever taught me how to play. So it's not that the parent doesn't want to play, it's just they don't know how to play. And so sometimes we can just like get in there and demonstrate, and kids learn through play. And I'm not even going to try and play this last video because I don't think it's going to work. I'm not sure why the videos aren't playing, but I will get the videos too. There's this beautiful TED Talk, and she's a little 7-year-old. And I think that this is such an incredible video to show to parents and caregivers. So this little girl, Molly, I don't know who her parents are, but I would love to meet them one day. She like is clearly wise beyond her years. So she is giving this TED Talk about how children learn through play, and she just demonstrates it really well with like, she has this little boy and his dad, and she like shows how this happens. And I'm like, wow, somebody clearly has taught this girl some really impeccable skills. And I think when parents and caregivers can see a little child talking about play, it just changes how they're getting the information. And I think this is such an incredible clip. So I really hope if I can get any of these clips to you, it would be this little TED Talk by Molly. She's just incredible to watch. I think just watching her talk about how just like little games of peekaboo are such a moment of learning and connection. And so she demonstrates peekaboo with the dad and the little boy, and it's such a sweet little clip. And it really takes away kind of the talking about it with like, so we don't talk about labels of kids or diagnosing, we're just talking about playing. And so I think that's like one takeaway is that can we do? We can't do a lot of things. We can't make formula appear on our shelves. Can't make diapers appear. We can't make people get jobs if there aren't jobs. We can't make those things we can't do, but we can definitely, at the bare minimum, is we can play. We can always play. We might not know how, and some of the work is just teaching people how to play. And you don't need fancy toys to play. I mean, you can play with almost anything. Kids their imaginations are incredibly wide. They can pick up anything. We can draw things on paper. I think like a year and a half, maybe a year ago, Long Beach First Five was giving like early developmental kits away to families with like little toys and things that they could have. And I think a lot of the public libraries have kits that you can pick up and families can access. So even if families don't have toys, there's ways to get them to play without having, the newest and fanciest toys. You can play a game with pots and pans and Tupperware. And cotton balls. You can get 100 cotton balls and play a game with them. There's so much that you can do. So some of it is just being open to trying new things. So I'm going to open it up to Q&A and kind of, I'll put the Q&A link back on here in case anyone wants to like be anonymous and doesn't want to ask me directly, but I'm going to go ahead and put it in the link again in case anyone feels like that's where they would like to do. I'm going to pull it up here. So you all should see the link for the questions, but feel free to just unmute yourself. I know there's a lot of us in this room, but I love relationships and connections. So feel free to ask questions and unmute yourself. I want to see everyone's faces, so I'm going to stop my share because I didn't get an opportunity to see you all that much. And I'll watch the questions in case anything comes in too. So if we look at kind of what you sort of wanted out of training today, did you feel like you got some of those things answered? Do you feel like, besides the fact that the videos didn't work, we'll definitely get you those because I think it's fun to show videos. And I think, everyone learns a different way. Some of us are like more auditory, like we can see it. Some of us are more like tactile. We need to play with it and watch it. And so I'll make sure that you guys can get all that information. I'll send that out. We have some comments coming in that they felt that the training was good. I absolutely will get a PDF of the slides. I can email that to Jana. So if anyone wants to, you remember what we talked about or things to look out. So I will get that as well as the links to the video for you guys. If we can, I know this like kind of puts everyone on the spot, but I love to do this. It's called like a chatterfall. And so if everyone takes a minute and if they can put like one adjective in the chat box for how they're currently feeling, it's pretty cool to watch a bunch of things just fall in a chat box. So if everyone can just take a quick moment, kind of like one sentence, like one word, like good, happy, I don't know, motivated or anything. So we see some grateful, hopeful. Oh, I love it. Lots of hopefuls. Motivated and validated. Encouraged. Power. Fun to watch all these. Satisfied. We have some really good ones. I know for me, like, as a mom, but also as a professional, I think having like opportunities like this, like the meeting of the minds and we all come together, I think is so wonderful because it allows us to connect with one another, but be able to provide and like dismantle some stigma that's associated with mental health. But I think the interesting about COVID-19 is like, we're all still in it, right? I mean, it's not gone anywhere and we're still here. We have so many different people on different sides, like to vaccinate, to not vaccinate, to mask, to not mask, to isolate, to not isolate, right? We have so many, and like kind of balancing like what our families that we're working with, but also kind of like what do we do when we're on different sides with different people? Like, how do we support, even if we don't agree with kind of what families are sharing with us? And so I think like having moments to connect with other people to talk about these things is really important. I know that like in the very beginning of the pandemic, and I was trying to support my staff, and I had a staff member come to me and she was really stressed out. And she's like, I'm stressed. I can't do this. I give up. I can't do this work. And I said, how can I help you today? And she was like, you can't. And I was like, try me. What can I help you with today? She says, I've been to 100 stores looking for size 6 diapers and I cannot find one diaper to put on my kid. That's really stressful. I got in my car, went to a couple stores, found some size 6 diapers for her, put it on hold, called her, said, remember how I asked how I can help you? And she said, you can't. And you told me you don't have, there's no way. Well, there's some diapers waiting for you at Target and I put them under your name. You go pick them up. That is kind of sometimes what we have to do. Is that like my job? No. Matter, right? That is what that person needed at that very moment. They need diapers. They needed diapers to put on their kid. They couldn't do the work that they needed to do. And they think that it's really important. So like sometimes we just have to ask the families, what is it? How can I help you today? Right? I mean, even if what they tell you is not necessarily something that we can do, we might be able to find something that can help them. I think I sent an email to my staff this past week about formula shortages, and I asked them to ask their families, to intentionally ask their families how they're doing. Even if they weren't seeing a little, that they didn't have a baby, the baby wasn't their client, right? I said, ask. I don't have the resource. I don't have the answer, but I'm going to ask if we get enough families who are without formula, and let's find where they can get formula. Let's figure it out together, right? And so I think some of it is being okay asking tough questions, even when you don't have the answers, and that's okay. I don't think we always have to have them. Sometimes we just have to ask what it is that they need. Well, I hope that you all had as much fun as I did today talking about something that I'm super passionate about, and that you can take at least 1 or 2 things away from today's training, and we will work on getting the videos and the slides over to you so that you can view them. I just appreciate all you attending today, and it was really fun to meet with all of you and talk a little bit about COVID-19. I wish I could have said in the presentation, and we're done. We've made it through the pandemic. It's no longer an issue, but we're not done. We haven't made it through the pandemic. We still have people on all sides of the pandemic, and we're still in the storm. We're just got boats going lots of different directions. So thank you all for all of the work you've done. I think that that's really important, that we've been doing the work through the pandemic. Like, we didn't stop. We didn't get a moment to breathe. We still haven't had a moment to breathe. And as our families have been going through it, so have you all been going through it. And so if you haven't heard how incredibly impactful you all are, I hope today that I leave you with that we continue to make a difference every single day. Anytime we're interacting with families, that we're making a difference. Even if on our hardest days, it feels like we haven't done enough, just being there, we've done a lot. So I'm going to give a big kudos to all of you for doing the work. So I'm going to give you all a round of applause, because I appreciate all the work that you all are doing every single day to help families, and while you're still trying to help yourselves too and your family. So thank you all for your hard work, and feel free to log off.
I think we've got one question. Our
Sure.
Elizabeth has her hand raised, so I want to make sure she gets her question asked.
I just feel like you hit it right on. Oh, can you hear me?
Yeah. Mhm.
Okay. Just a comment and kind of like a question of our mental health and how we are kind of coming up out of the pandemic too, going back to home visiting, going back to the community, and having that time, in the car, driving in traffic again, and kind of you said it at the end where, giving ourselves the claps that it's hard to go back to things and really take the time to breathe before we go back into the home, because our clients feed off of our stresses, and they feed off of how we go into the home too. And so I like that you said that, and I appreciate the claps for sure. And
Yeah.
I extend it to all of you too.
Yeah, it is. That's so true. Our clients and our families who work at do like feel our stress, but we are human too, right? Like,
Mhm.
I don't know. I'm in general tend to be very transparent, and I think that it's okay if we're stressed and we're feeling something. I mean, we'll deal with it, right? That's why we have supervisors and things to get resources. But no, we're human too, and so we haven't had a moment to breathe yet either. So taking those moments, I don't know if it's in the car, the transition, anything to help do that self-care to support your own process is super important. Let me make sure I didn't miss any other hands. We got the 2 screens here. Looks like no other hands might be missed. Thank you for whoever pointed out I missed it. Let's see the hand. We all need, a little more self-care. This idea of self-care is so interesting, as like we tell people you need to care for yourselves, but then we're asking them to do another task for themselves. So I think like self-care has to almost switch to whole care. So like how as we as a whole can help each other, because it's like, okay, you want me to do self-care? I've already I've spent all day helping others. Now I got to find energy to help myself. Right. And so that's such a hard concept. So like, I think all of us can help in whole care, right? And like switching, like self-care is important, but how can we help each other with that? Doing a fun little get together, or driving, going to the park. I don't know. I love the ocean. So like sometimes just, quick little ocean smell or something to remind me, or taking a moment to breathe in the sound of the waves or anything like that, but definitely knowing what it is that can fill our buckets. So hopefully you all can take a moment after you log off to put something in your bucket, whatever it is, and add it in. And thank you all for being here.
Thank you so much, everyone. And thank you, Jamie. That was wonderful. I think everyone really gained a lot from your presentation today. So we really appreciate you and your time and your expertise and sharing all that with us. And to everyone else, thank you so much for spending time with us this afternoon. We'll send out the links to the videos that Jamie was going to share today. And then we'll also send the PDF of the slides. And we look forward to seeing you at our next webinar. Take care, everyone. Have a good rest of your day.
Bye-bye.